So what we're going to talk about for the next 10 minutes is some work that myself and my colleague Natalie did within all of our systems in relation to integrated care, what's needed in terms of collaboration to help us to get the best out of it and to properly move quickly into what's needed, so to hit the ground running, really, I suppose. And so far we've talked about the what, and we've said what does this mean? And so I'm going to talk to you now about the so what, and just describe a journey that we've been on in terms of our learning and why we've done that learning. So in the Innovation Agency and the Coaching Academy, our role is to innovate, to pick up others' innovation, to spread, and to help systems adopt whatever that innovation is. And that doesn't just mean something that you plug into a wall or a piece of kit. It means how people think innovatively and creatively. So we undertook some action learning over the last couple of months to understand with a bit more depth exactly what people are feeling about this complex system at the moment. And we asked people, what would a healthy system culture look, sound and feel like? And we did this in a variety of ways. So we used the design thinking process, which I'll show you briefly in a second. Can you just go back one slide, Lindsay? Thank you. So we used design thinking, and we specifically looked at one element of that. We used focus groups across the UK. We invited people everywhere to join the focus groups and to give us their opinion. And then we also did an online collaboration tool called Idea Drop, and that was using some grounded theory to look at the initial conversations in focus groups, deepen them and widen them. And then also myself and Natalie undertook a hefty bit of desktop research and a literature review. That literature review looked at systems, it looked at collaboration, but it also involved an organisational development lens. In other words, what would help the system to use the knowledge that we're gaining. Thanks, Lindsay. So this is for those of you that have not seen it, it's the design thinking process. So you start with a problem statement, you widen your thinking and you do your research, and then you come back to your design element. And you can see right at the front there, it talks about empathy. And so there is a process called empathy mapping that we use that said, okay, who's our customer, who are our stakeholders, and what do they really need in order to join the ICSs, feel part of them and feel like they've got a place and that they can contribute to the success of that. So that's the system that we use, and currently we're still in the empathy stage, but we're starting to define, and my colleague Natalie will talk to you about how we're defining that as we move on. Next slide. So this is just to show you that from all of that research that we did, all that listening, all that collaboration, we came up with a set of themes, and these themes weren't ours to begin with. So Maria and Jill talked earlier about clinical care professional leadership, and they've already identified these key themes of leadership and collaboration, shared learning, how resources are used to support the system, and also talent. So what do our future leaders need, and what will the framework be that they'll need in order to successfully lead in this new space in the system? And we also, through our conversations with everyone, heard repeatedly how important engagement is in that process. And we began to feel that actually the engagement, it can't sit out with that learning, it's got to sit within that loop, because if engagement doesn't happen, we don't listen, we don't empathise, and we don't understand what our colleagues are trying to tell us. So we've said there are 5 themes plus one, and the plus one is engagement. And you can see the balance there of hard and soft. And what we're talking about here is it's not just the hard stuff that you need to do. So in other words, embedding new processes, you know, budget lines and policies and procedures, they're crucial to the development of an ICS culture that's healthy and safe. But you also need those soft systems which are around the people. Next slide, Lindsay. So just very briefly, for those of you that are not used to organisational development, these are some of the tools that we researched in the background. The one on the left with the turquoise boxes on is actually psychological safety model, which Amy Edmondson talks about a lot. And specifically on this model to create a feeling of safety where we can all engage and feel like we own and participate in the ICS, we do need a level of accountability. And that can be gentle accountability. It just means reporting in and holding ourselves to account for the work that we're doing, but that it doesn't sit in isolation. It's got to be around helping people to feel safe so they sit in that learning zone all of the time. And the McKinsey model there just talks about there are 7 elements to change and to high-performing teams. And in order to get that right, that goes back to that balance of hard and soft. So you can see there that it talks about strategy and structure. And of course, we do need all those policies and procedures in place, but we must do it with the right skills, the right staff, and the softer style and culture, which is what we were looking towards. Okay, thanks, Lindsay. I think it's crucial, as I said, that we blend those 2 elements together. And what we heard from the system when we went out and engaged with people was these things on the slide. So an awful lot about sharing information, sharing data, budgets, so on, shared decision making, shared risk. As an old girl in the system that's been around for many years and seen these transitions time and again, I remember the old days, and some of you may, where we had FHSAs, Family Health Service Authorities, where we were one big organisational culture, really. And it was when that separated that we started having silos around our decisions and our resources. So we're going back to that. People are saying to us, we want that back again. I think critically, what we heard, this is all the stuff you're telling us you need, but what we heard underneath that was 2 things, that really we've not yet got the socio-economic stuff right. So looking at the wider system, looking at our public health data, how our public health data sits right in the middle of that and influences where we focus our resources and our time. And we heard that loud and clear. And we also heard the conversation that you've all echoed again today around, well, is it a citizen or is it a patient? And actually, no, it's not a patient, because it's not just about health. And we also heard some of our colleagues in the focus groups saying, actually, it's not about a patient at all. And what are we going forward if we're going to create this new system? So it's good to hear you echoing that conversation about citizens today, and also that we're paying them lip service at the moment, and we really do need to put our money where our mouth is and start collaborating differently, and those conversations were heard loudly. And I think finally, the other thing that was heard was that leaders are stepping into the space now for ICS, but they're still quite unsure. And those leaders that came to these meetings were saying, we need to step up and out, but we're still understanding what we're stepping out into and what's needed from people. Thanks, Lindsay. So very clearly what came out of that information gathering empathy mapping session was that there are 2 things we need to look at, and we can't look at either of them in isolation. We have to balance them and look at the 2 together and then blend the learning. One of those is the individual and the other is the system. This is the McKinsey, the system is the McKinsey 7S, the hard stuff, the structures and processes that will create those safe boundaries and the accountability that we'll need to make this work. And then sitting within that is the individual, how they feel, how they operate, their mindset, really the bottom of that iceberg, the hidden stuff that's often unconscious as well, but that we bring to work every day with us and can influence the way that we will act in that system. And that really needs some attention. And so what we came up with at the end of our information gathering session was, well, how do we understand what the individual needs and what the individual is experiencing and use that to inform the system? And why is this important? Because we are the system and the system is us. So a couple of years ago, when I undertook my master's degree, I did my research on what the system is, and I looked at compassionate leaders within a system. And what I learned was that the language we choose sets the mindset within the system, and then the system behaves accordingly. And when we join that system, when we become part of that culture, we all have a golden opportunity to influence that and change it or not. And it was interesting earlier to hear that, you know, we have a time when new people join a culture and a system to influence that change before they get sucked into this is the way that we do things here. And that was being echoed in the conversations that we were listening to. Thanks, Molly. Okay, next slide. I'm speeding up a little bit just so that we keep to time. So here's the crucial learning that we gained from our action research, this thing about language. So creating new language, and that new language will help us to set the culture for our ICS. I've worked in a place previously where there was definitely punitive language was used and criticism of our clinicians and our leaders. And what that did was create a mindset, and that mindset became very defensive. And in a defensive mindset, we hide things. We don't look at safety well, and we don't look at lessons learned well. And so in order to create psychological safety, we need to think again about the language that we're using. And that could include, you know, are we talking citizenship, or are we talking family? What's the language that we're going to choose? But also critically, and this came up through the CCPL work that was done, so the framework that Maria talked about earlier, we need to start describing place, neighbourhood and wider system, and we need to start using that language when we talk to our colleagues who don't yet understand or haven't yet heard the stories about place, neighbourhood and system, and that will help to embed the new mindset. Excuse me. So the mindset that influences the culture will come from our choice of language, and interestingly that will include digital traces. In other words, how do we behave on email? What do we put out there on Twitter? When we're talking amongst ourselves in messages, in emails and so on, what types of descriptions are we using that describes the system? Because that will influence our mindset around the culture as well. So, you know, when we hear things like, well, this is an audit system, how does being in an auditing system help our colleagues to think about the culture that they want to see, the relationships and the negotiations that need to happen? And then obviously this willingness. So we learned that people are very, very willing to commit and join, but they're very nervous as well, and they're not quite sure. And we heard some overwhelm, and particularly I heard overwhelm from primary care. So what they were saying was, what's going on here? How do we get into this? What does it mean, given the different cultures from acute, primary, secondary care? And the answer to some of that uncertainty is, look, you don't have to do this work, but what you have to do is be prepared to engage in it. Some of our clinicians were saying, I've not got time to do this really critical work. And that's fine, you don't have to do it. But what we would appreciate, and what everyone will value from in a high performing system, is you joining in and contributing and giving your part to that conversation, to that new language, and to building those stories that are needed, rather than needing to think that you're the one as the leader that has to do that, because you don't. Okay, thanks, Lindsay. And this is my final slide. I think I may just have kept to time. It's a really complex slide, but it's talking about system maturity. And if you think back to this first slide that I showed you when I talked about empathy mapping, on the left-hand side of this slide where it says, what's the capability, what's the user needs, what's the system requirements, what's the architecture of that system, what will a subsystem look like, how will we have components in it? That's empathy mapping. It's just different language. And straight away using something like empathy mapping softens it and makes it easier for people to digest, really. But the ultimate aim of that is that you get to a build. So you get to a place where you can say, okay, we're thinking about culture in the ICS. We now understand everything we need to know because we've done that listening, we've done that engagement, we've reconnected with people and made sure we've gone back and checked out stories. We've built, we're ready for a build. And then as you come up the right-hand side, you're taking that empathy model further into let's design a prototype, let's test it, and let's keep iterating it until we've got a place where we feel comfortable and safe. So I suppose what I'm saying is we learned an awful lot by listening. We did the so what by asking those questions, clarifying them and confirming them. And we're now moving into a journey of, are there some tools that we can help you with that will help you to get to this really quickly in your neck of the woods? And I'm going to stop there because my colleague Natalie will start describing some of those tools to you. Juliet, do we have time for any questions or do we move straight on?
Hi, thanks, Wendy. I think that it'd be good to move straight on just in the interest of time. I think, you know, looking at the chat box, if you want to have a wee review of that and respond directly in the chat. I think there's been a lot of reflections on, you know, hitting a nerve in terms of the you know, people seeing the system and themselves as separate when actually we are part of the system, we are the system. we influence the system. And I think that really hit home in what you were talking about, and using the use of language. And I think it's the use of language, but also the energy that you bring in a room when you're talking about these things, or that you display, the behaviours that you display in non-verbal, are really important, shaping the feeling of what we're talking about, and the optimism or pessimism. So being aware of energy, I think, is really important.
Yeah, it would be lovely to spend a whole day exploring that, wouldn't it? Trying to squeeze it into 10 minutes, we'd probably have missed some really important points. But yeah, thank you.